Awesome. Good morning, everybody. This is Rolando Mia with Zyris. I'm here for our session and have a wonderful guest here, Dr. Louis Kaufman. Dr. Louis Kaufman is a dentist in Chicago. He's a very good friend of ours, and he's been a huge advocate in dentistry. He's a natural educator. He's a fellow for the Academy of General Dentistry. He's also an administrator for Smile Source, and I've actually had the pleasure of sitting in on a whole bunch of his lectures and his educational programs. So really excited about spending a little couple of minutes here with him and getting his insights on what are going on here. Good morning, Dr. Kaufman. Welcome.
Good morning, Rolando. How are you today?
Yeah, very good. By the way, those of you who are going to join us, if you want to send any questions or if there's anything, or please send a note in and we'll make sure we address that as we go on. So before we begin, how are you, sir? I mean, how are you, your family?
Everybody is safe, Rolando. I really appreciate you asking. Thank you for having me on here. So I'm doing okay. I've been on my bicycle this morning, and it's a beautiful day. Did some calisthenics, some working out, and it's all good. You got to keep your sanity. That's my way of keeping my sanity.
So I'll share with you. I woke up, cleaned up, brushed my teeth, got coffee, and put on a shirt. So I'm doing good. So you're making
good. That's right. When I get done with you, Rolando, I'm sure I'll need to meditate for a little while. I'll do some new calm.
There you go. So if you would just, if I understand correct, your background in dentistry is quite different, because you didn't start out initially or directly in dentistry. You were actually a business person. You also have an MBA. So could you kind of summarize or share with us kind of how that happened?
I'll be happy to. So we don't have a ton of time, so I'll give you the shortest version I can. I graduated with a BA, got my MBA, and then I went working in the fast food industry for Burger King. I did that for a few years, and I was like, there's more to my life than flopping burgers. But that experience there gave me just a real world MBA, if you will. One day I showed up at one of the restaurants I was turning around because I became a specialist in increasing the value of restaurants. A deposit bag went missing.
Ooh.
Yeah. And they brought me and several others in for a lie detector test. And I was like, well, F you pretty much. And I went and took the lie detector test, and I got back to the restaurant and left my keys on the desk. I had called my boss and said, look, I'm done. And then I did a year of education and to get my science degrees and applied to dental school and went to dental school. And then about 2/3 of the way through my first year of dental school, not a lot of people know this, I got brought into the dean's office. I knew it was coming. And I sat down around a whole conference table of all department heads. And I was like, you got great clinical skills, Kaufman, but you need to repeat your first year. We'll give you the opportunity. So I did that. I did 5 years of dental school. I was 29 at the time. And I wasn't married, didn't have kids. I had the flexibility to do it. And I just committed to it and did it. And looking back, I wouldn't have done it any other way again. Maybe do it 4 years instead of the 5. And then so I've been around dentistry my whole life. My earliest memory, because my dad was a dentist as well, was being about 3-4 years old and going to St. Bernard's Hospital in Chicago. Because in those days, you're talking 1965, 66, most of your oral surgery was done in hospitals at that time. And they did a lot of sedation in hospitals. And I remember going in and these, I'm Jewish, obviously. And my first experience is I remember 2 nuns greeting me and telling me, look, you need to stay in this room until we come and get you. And I was like, oh, okay. So I was frightened a little bit, and everything worked out great. And, so now my entire life has been around the industry. but 25 years actually clinical practice, 5 years in dental school.
Wow. That is, I did not know. That's pretty cool. I love the, I love the story. So it's amazing when you think about, you know, what we're hearing so much about this crisis, COVID, I mean, all that type of stuff. Everyone's talking about it. But one of the things that seems to be really resonating is this is almost like history repeating itself. It's almost like, you know, we've been here before. Because you have a business background before being in dentistry, but you've also been in dentistry for so long. I'm sorry. What are your thoughts with regard to, you know, where you see this going, or you know, how would you kind of, from a business perspective, see where do you see dentistry going after all of this? What are your thoughts on that?
So I'm going to answer this 2 steps. I look at this as before coronavirus and after coronavirus. So BC, AC. You know, I think dentistry is going to be okay. I think we're going to be fine. I think until we get back to a normal where we're being productive and getting back to a more structured environment, I think we probably got a good 6 to 9 months before we see that. I think we'll be back to work much sooner than that, obviously, because the curves are flattening. We have to see what comes down from the CDC. We have to see what comes out of OSHA, the ADA as well. And I think, you know, where you practice is going to have be impacted as well in terms of, you know, patient flow and how busy you are. I think we're going to see a lot of emergency. I think we're going to have a lot of recall patients that have been waiting to get their teeth cleaned. We're going to have a lot of work that we have to finish that we had started prior to this. We have a lot of people in temporaries right now. And, you know, you're going to have to be committed to putting in some extra hours, some longer days maybe. But the biggest thing is don't burn yourself out. I mean, that's what I'm worried about for some people. I mean, I'm an older guy, you know, and my energy levels are somewhat depleted than they were, you know, 10, 15 years ago. That's just a fact of life. And it's different for everybody. But your team's got to be committed to put some extra time in as well. And you know, we'll be playing a little catch up, but I think the production will be there, and we'll be able to take care of people. You know, it's not just dentistry. I mean, this is like, you know, somebody took a faucet and they turned it off, right, for all of us. Right. And it's going to come back on slowly. And it just has had this huge wave effect in every industry practically in this country and around the entire world. So I think it's almost a reset for all of us. I mean, on a different note, I've had some great family time. Last night I sat down with my son and watched a movie for a couple hours. Like, this is my God, you know, this is fantastic. We had a nice dinner, we grilled. That's great. You know, it's easy to get sucked into everything we're seeing on the internet, and you got to pull yourself away from these webinars, and in my opinion, and take care of yourself. Be present right now. Gave you a little more than you wanted, maybe.
No, that is awesome. I love the context of BCAC and how, yeah, this is, I agree with you, and I believe that this is going to completely change everything, and it's huge, especially for dentistry. You know, there's a lot of anxiety, there's a lot of fear right now because, you know, dental teams, and I'd love to hear what you're doing, you know, they're on furlough. Organizations, they're on furlough. People are no longer working, and they're sitting there going, holy cow, what do I do? Unemployment, you know, you hear all of that, to your point. So what kind of, you know, a lot of younger dentists or dentists who are starting out are feeling the impact of that. What advice would you give them, and what are some thoughts around that?
You know, for the younger dentists just starting out, oh my gosh, I'd be really scared. I mean, I'm more fortunate because you know, time spent in the trenches, money put away. I think they just have to take a deep breath and realize it's going to take time to come back. First and foremost, make sure your team is taken care of, your family's taken care of. What I did is I have a team of 14, and we put 7 people on unemployment essentially right now because the government really didn't seem to know what was going on at the time. And I said, look, you have a position when this calms down and we're on the other side of this, and I keep in contact with them every Wednesday. We do a Zoom call. It's great. For the younger dentists, just hang in there. This will pass. We'll get to the other side of it, and life will get better. I hope the government does something about their loans. I mean, there's got to be some forgiveness in dental and medical. These frontliners out there. I mean, help these people out. I don't know if I'm absolutely answering your question.
No, you are. You are.
Okay. But that's what I do with my team is I just had to give them time to, understand. I mean, I brought them in a week before we shut down and told them this is where we're headed. This is what's going to be happening. And at that time we were supposed to be back to work like 2 days ago. And then we got the extension. So you're rescheduling a full schedule. I have 3 hygienists, 2 doctors, besides me in the practice. It's a lot of people you got to reschedule. And there's practices much bigger than mine. I can't even imagine what they're going through. I would tell young dentists you should be embracing teledentistry right now. You should be taking advantage of it. There's many companies out there that you can use. I signed up personally with Simplify, so you can keep in touch. I think you should, in terms of social media, you should be posting things to your patients, sending them letters, personal. Just stay in contact with them. Let them know you're there. Pick up the phone yourself and call some of your patients. I think that's important to have your team members do that as well. But the younger dentists, this will pass. We'll get on the other side of this. It just doesn't seem like it now. We always do. And in terms of history repeating itself, I was thinking about this morning. Thankfully, we live in this age where we have this type of communication between each other, and we can share information so rapidly. I mean, you think about 25 years ago, we couldn't do this. We couldn't communicate like this. Everything would be via, I still have a phone on my desk. There you go. Right? We had dial-up modems. And anything before that, it was newspapers or the television, how we communicated. Can you imagine being isolated in your home right now and not be able to talk to the outside world?
That is absolutely incredible. And you're right. With technology, it enables you to kind of get out there and reach out and touch people. You mentioned to me before when we were talking, and it's something that struck me. You go out to mentors. You talk to consultants. You actively engage people. You work with them. What are your thoughts around that, and how can that help get us through this?
So I've always been a firm believer that I don't know anything. Seriously. There's so many people that know so much more than each of us, and we're as powerful as the people we can surround ourselves with. We just can't know it all. There's no possible way. So I've always I've had consultants over the years that I've worked with, whether it was speaking consultants, whether it was right now I'm working with Tower Leadership actually. They're a consultant to me. Eric Morin has been fantastic with his group. So it's a shout out to him that was unsolicited. And my Smile Source, guys, I would share information all the time back and forth. That's been supportive as well. We have to realize that there are people that can help support us no matter what we're doing, where we are in our personal life and in our business life. And they can help us find the answers that we're searching for. It's like having a personal trainer. They're going to help push you, steer you, focus you, and those answers can come.
And I love the message. Don't be afraid to reach out and ask for the help.
Right. I mean, hey, I'm scared. I get nervous. I'll make sure I have a practice to come back to. I'm confident I will. But if I go down that rabbit hole and I think negatively all the time, that's what's gonna manifest for yourself. You have to stay positive. I started embracing vision boards, years ago, and I think everybody should have a vision board. What you're looking for out of your life. You have a set amount of time that we're here. We don't know when it's going to expire. And then an event like this comes, and you're like, it's a reset time, right, for all of us.
That is awesome. I love that. I love that. You mentioned Smile Source, and we've been working with, and we love the Smile Source organization. The context of independent doctors who have the ability to kind of get together, share information, see all that type of stuff. You had mentioned to me when we were talking before that you have these, like these fireside chats to stay connected and all that type of stuff. And what are you hearing from them, and what you want to share to our listeners who are on now, and also this is going to be other people going to see this. What can you share about the things that are happening, and then also the advice or the information that you're able to share with your SmileSource colleagues and other dental practices?
I'll tell you, with SmileSource and our fireside chats in the group. Well, let me say this. I look forward to that group every night. We get at 7 o'clock Central Time. It's open to all dentists. You go to smilesource.com. There's a little bit of vetting that has to go through, but you can find out more information. You can reach out to me via Facebook if you want, or my email, which you'll get from me later. But there's information being shared from dentists all around the country, and it's interesting because certain parts of the country got shut down faster than others, and other offices. Some people were still doing dentistry, others weren't, and it's the same stories you hear. People are scared. How am I going to figure out? How am I going to get through the SBA loans? How am I going to get through the PPP loans? But you have this camaraderie, this brotherhood, sisterhood, if you want to call it, of people who generally care about each other. I mean, everybody gets along. It's a strong community. I reach out to my members, locally, engage with them, talk to them, try to figure out, what are you working on? What's going on today? How can I be a help? What's your opinion on this? What did you do to handle this? I've also, even if you're not a part of SmileSource and you're a dentist listening to this, reach out to your dentist down the street. Maybe you never talked to them, but reach out to them and see how they're doing through this. I've met a lot of dentists along the way, and I've reached out to some of them that were not SmileSource as well, just to say, hey, I'm here. I don't have all the answers, but maybe I can help you, get through whatever situation. It's that human touch that we all need. We all need that contact of somebody else. SmileSource, I always tell you, it's not a buying club. Because people get that stigma. It's not a buying club. We are a group of independent dentists that are preserving this unbelievable profession of dentistry, and our mission is to preserve it and to stay strong. And it's not judgmental. There's egos are left at the door, and we have a lot of fun when we get together. Unfortunately, we're not going to have our huge exchange this year. It was supposed to be in Atlanta, but it's just a great group, and I'd really recommend, dentists, you practice by yourself, your own practice, just come check it out. It's a great group of people that I've enjoyed being with.
I love that. Thank you for that. And the message, which is whether it's SmileSource or it's the dentist down the street, that message, which is reach out, talk to these people, because I guess we're all in this together, and it's a really good opportunity to kind of see what other people are doing, share what's going on, and this way you're not just by yourself. Because I would say, thinking about that, how terrifying it would be if you felt you were alone. So thank you for the message. I love that. That's really cool. So shifting gears slightly,
okay.
There was a webcast, and when you look at this virus and you look at this issue of aerosols, when you look at this issue of infection control, when you look at there's people wearing masks and gloves and all sorts of things, and that's gonna continue. From a dental perspective, what message do you want to get across to patients? What are your thoughts, or what are you thinking about with regard to what people need to know about aerosols? About there was the Christiansens, Dr. Gordon,
Mm-hmm.
Dr. Rella. They mentioned this whole context of constant evacuation. You look at the infection control protocols. There was a hygienist, Michelle Strange, who was someone who spent time with us around that. What are your thoughts around how this is going to affect infection control and how you are going to operate in your practice with regard to aerosols and all the kind of splatter stuff that we're seeing. So
all the crap that flies around in dentistry, you mean? So dentistry, we've always used, great PPE. We always have. The question regarding, in terms of our own personal protection, we have been using, your product, the Isolite system now forever. We have one in all of our chairs. And I said to my team last week on our Zoom call, I said, I want it understood that Isolite will be used on every patient in our practice from now on when they're in our chairs, period. End of discussion. Because when you look at the studies, the only way to reduce that aerosol completely is throw a rubber dam on them. So it's going to be Isolite and high-speed evacuation. Because the only time we're putting on rubber dams, typically, at least when I'm doing, is when I'm doing a root canal. We have to limit it. We are protecting ourselves. We got to make sure we're protecting our team, and we got to make sure we're protecting our patients. There's a whole lot of talk about air filtration systems. About 3-4 weeks ago, I ordered a couple surgical air cleaning units for my practice because one, I want to reduce that bacteria and viral count load that's in the air of our offices, and try to provide a much safer environment for everyone. But we have to protect ourselves. We have to protect our patients. And, it's proven, when you work with a system that allows you to isolate and have all that evacuation and suction, it's phenomenal. It even makes your life easier as a dentist. Go figure. We'll take that.
Well, appreciate that. That's not what I was fishing for, but
but it's the truth, though. If you read the studies that have been done, I can't remember the name. I just had one that crossed my desk like a week ago, that it pointed out rubber dam, 0 in terms of the amount of aerosols really being released. Isolite and a high-speed evacuation, the parts like per million or what it was, it's like 0.001. That's huge. Why wouldn't you want to use it? Especially until we get this figured out, until we get testing in place, we know who's got the virus or who's had it, the antibody tests. We got to have a systematic way of treating our patients so we can get back to work.
Yeah, thank you.
That's my opinion.
Yeah, no, because there was the podcast that Rella Christensen was on about constant evacuation, eliminating those so the filtration. That's kind of interesting because I've been told when you're in a dental practice, splatter you can wipe that, but the aerosols are really difficult. And thinking about managing your air, that's kind of, and you're already stepping ahead now to do something about it. So that's pretty cool. So really, really cool.
Thank you.
Yeah. So from a patient perspective, what can you tell, or how are you communicating to your patients not to be afraid to come back in after all of this is done, and that they're all sitting back going, wait a minute, I have issues here, but I'm afraid.
That's a great question. It's a great question. And, patients are getting so much thrown at them right now. If I go ahead and start saying, this is what I'm going to be doing. This is what I'm going to be doing to protect you. I'm going to stir up more fear in the long run. I think as we get closer to opening, whenever that day comes, I said, then we can start introducing those messages. And it's letting them know we've always followed, sterile procedures. We've used protective equipment for them, PPE. I think it's ensuring that we've always been doing our best to protect their overall health and set them at ease. And what form more of those conversations will take, I'm not sure yet, but I know in my head, I need to start having those conversations, not right now, but a little bit later. Because the fact is, I'm closed for the entire month of April. And if you look at some of the data sets coming out, we might not be back open till the middle of May. We just don't know yet. So they're worried about loved ones right now, their families, everything else. When they want to come see us right now, it's because something hurts, because it's an emergency. And when they are coming in, we have a protocol for that as well. Their temperature's getting taken at the door when they show up. And we know we're wearing N95 masks and we're protecting ourselves as well.
That is cool. Thank you for that. Yeah.
You're welcome. You're welcome.
Yeah. So from a business perspective, this is definitely going to affect what's happening in your business. And when you look at dentists and their offices, they are small businesses. And, what advice would you give people with regard to kind of shoring up and what to do now, and then so that it can affect going forward? Any thoughts on that?
What you can do now is, hopefully by now you've all contacted your banks, your mortgages, your labs, your vendors, and deferred all payments. That's what we've done. And you also should have done that in your personal life as well. Defer as much as possible. Cash is king right now. You want to have as much of that as on hand. And reduce your payroll. Get your pay, whether you're going to do PPP, if you're putting them on unemployment, take care of that. That's one of our largest expenses that we have. You got to get it reduced and under control right now. You need to figure out, if you have receivables on the books, figure out how much you need to survive each week, bare minimum on a personal level for you and your family, and create a budget for yourself. In terms of looking, forward, do you have, goods on hand in order to move forward when the time comes? You got to start thinking. We don't want to take anything out of our first responders' hands right now, but we got to thinking, do we have the protection in place? And if I don't have the protection, where am I going to go get it? Am I going to get it from, it's going to be Shine, Patterson, Darby? Is my Smile Source partners helping me, figure that out, which they are. High school I grew up to, they're making face shields right now. I just found. It's interesting how many companies have stepped up around the country, or high schools or kids are using their printers. I go on tangents, that about me. But you have to protect your business in terms of, okay, I don't want to be bleeding. I don't want that money going out, any faster than it has to right now. I got some fixed costs, and you want to get your landlords, et cetera, everything in place. And if you do have some receivables and you can throw some money towards those people who've helped you out over the years, you want to send some money their way as well. But you got to limit your spend, and you got to look long term. How far out can I keep surviving?
That is cool. Thank you for that.
You're welcome.
So from your perspective, as a person, as a leader, as the owner of the practice, someone responsible not only for your family, but for your team, for your patients, how do you stay motivated? What do you personally do to stay on? You've always been such an optimistic. You have this wonderful, hey, we're going to get through this. What do you personally do? What helps you get through that?
Great question. So I always make sure every day I try to do some type of physical activity, and it could be a wide range. I'm not, that guy on the beach with the muscle-bound body or anything like that. Never have been, but not like you, Ro. But I've always, I picked up cycling about 6 years ago, which has really helped me. If I can't get outside, I got like elliptical in the basement. I have a treadmill downstairs. I got a heavy bag. Jumping rope. I try to make sure I eat well most of the time, but sometimes you get urges, man. We're stuck at home, and I go for the apples. I go for the avocados. I try to go for the healthy stuff. The other day I had an urge, and I grabbed an Oreo, a couple Oreos, maybe more than a couple.
No way.
Yeah, right?
Oreo.
Right. So, but you got to be careful with sugars, because it's so bad for us. Not just for your teeth, but it's bad for increases your inflammatory responses, et cetera. It's just not healthy. So that's what I do. But I also meditate. As you know, I've been part of the Newcom endeavor for now 11 years. I can't believe it's been 11 years. And I thought it was just, very hokey when I heard about it. But basically, it helps me meditate, and I do it every day. And it's either 20 minutes to an hour, and it just helps reset your autonomic nervous system. And that has helped me greatly to stay positive. I also, if you looked around my office where I'm sitting right now, I have, positivity signs everywhere. I even have them in my closet upstairs, to be grateful every day that you're alive. I mean, things could be a hell of a lot worse for us. And and always remember to be present in the good that you have in your life. So I try to practice gratitude. I do practice gratitude every morning, and think of things I can be thankful for. It's so important, and especially during a time like this where we see so many people dying, and it's sad. I mean, you think about it. Every day I talk to somebody who knows somebody who's either in the hospital or has passed away because of this virus. So think about what we have to be, be present and be grateful.
I love that. I can see how it grounds you, and when you're strong, you're able to deal with and help other people. So thank you so much.
And I love that. You're welcome. I love it. I mean, my team. I mean, I started shedding tears that day with letting telling my part of my dental team that this is where we're at right now. Be human, and I've gotten a little more spiritual lately as well. I mean, I pulled my Torah off the shelf the other day and started just reading verses, and wherever it took me to, that's what I would read.
Thank you. Thank you for sharing.
Yeah, I think everybody should embrace their spirituality.
No, that's cool, and I admire that, and I've seen it. I felt it with you for we've known each other almost 20 years. Isn't that crazy?
Wait, that long? How's that possible? How is that possible?
No, thank you for sharing. Thank you for being so open. Thank you for letting us know that. Any final words for our listeners? There are a bunch of comments in here. People just absolutely thinking you're awesome. What final words would you like to, as we kind of bring this down to listeners, to people, patients, that type of stuff?
Oh boy, you get me on a roll. Take care of yourself first. I guess that's my biggest message, is try to take care of ourselves first. Because if we can't take care of us, we're not going to be helpful to anybody else in our lives, our family, our kids, our business. Take the advice of getting some fresh air when you can. I know it's different no matter where you live. If you live in a highly dense populated area, you're not going to be able to take walks real freely. I mean, I'm lucky. I live in an area where I can go and walk down the sidewalk and really not run into too many people at a time. But get some fresh air and get off of this computer. Seriously, don't get sucked into these computers. Don't get sucked into all these webinars. Dentistry is not going anywhere, folks. It's still going to be here. People are still going to have toothaches. Eventually, they're going to want all that fancy cosmetics again. They will come back to our offices. We will be fine. It's going to take some time. It sucks right now for all of us, but it will get better. If you look at every tragedy, Rolando, and you know this as well as I do, that has occurred in our world, we always come back, and we can always come back stronger after it. And we live in the greatest, and to me, we live in the greatest country in the world right now.
Awesome. Thank you.
You're welcome.
So much. Thank you for that. So, first of all, thank you so much for taking the time. I love your perspective. I love the message that you give. Those of you who are watching, Dr. Kaufman is. If you have any questions, what's an email that we can people can send or reach out to you on?
Okay, my email is LOUKAUF. That's an F as in Frank, @gmail.com.
Awesome. And if you have any questions, please reach out to him.
Facebook too. I'm on LinkedIn. Message me, friend me, whatever I can do to help. I would love to do that for you. And fireside chat tonight, 7:00. I have to add that in as well, because I love ending my day there.
That is awesome. And then anybody, if you like this series, or if you have any additional questions, please put them in the comments. If you do like it and there are other people who can benefit from this, please share it with other people, let people know. We're going to have an ongoing series like these. Dr. Kaufman has been fantastic. Thank you so much for taking the time with us. Please be safe. I love any time we have an opportunity to hear from you, and thank you. Thank you. Hope all's well, and I'm sure we'll talk again.
Thank you, Rolando. It's great to see you and talk to you, and look forward to when we get to do this in person again.
Awesome.
All right.
Thank you.
Take care.